You see, Medicare covers doctors and hospitals. Medicaid fills in on some of the other kinds of support for people who are both sick and poor. So in old age, the safety net is Medicaid, even for the middle class. So people think about Medicaid being for poor people. But all of us are at risk of becoming poor by simply outliving our resources, and especially if we outlive our resources in an expensive way, needing to be in a nursing home, needing ongoing support at home. Those things really use up whatever resources we have. So Medicaid is the safety net for middle-class people going into old age. It is very much a poverty program. I mean, you don't have any assets left when you're on Medicaid. So you have your medical services and your Medicaid services, and that's it. So that's sort of the current safety net. We've never built it strong enough to withstand doubling and tripling the numbers. So as we get more and more people who need those services, Medicare is anticipated to run out of its trust fund in about 7 or 8 years, if I remember right. Medicaid is never a trust fund issue. It's a current tax base issue. So are we really going to raise the taxes enough to support huge numbers of people? Now, in 1900, most people coming at this part of their lives would have a large number of progeny that would still be around to take care of them. Someone has once told me that a woman at 80 would have 60 progeny of one sort or another, and somewhere among that group there'd be somebody who could take care of her, or 2 or 3 such people. We will get down to almost 1 to 3, counting everybody in the community, not just the people who are descendants of this person, counting everybody. So we just do not have the wellspring of younger people ready to provide care. And as if we had set it up to make it even harder, the generation behind the boomers have inadequate retirement savings for themselves. So the generation before the boomers mostly had good pensions. The boomers have a mix. Some have good pensions, some don't. Some have adequate savings, some don't. But the generation behind has thoroughly inadequate savings because they have been on defined contribution plans rather than defined benefit plans, if they're qualified for a pension at all. So we have many fewer people who have pensions, and those that do have inadequate pensions. And every boomer had only 1 or 2 kids. So instead of looking around to see 4 couples who could maybe help, or 6 or 8, you instead have 1 or 2. And they're old. So the boomer at 90 is looking at their kid at 65 or 70. So those people have to keep working in order to provide for themselves. What are we going to do in order to have people able to take care of the elderly? We are going to have to learn neighborliness. We're going to have to learn how to help out by delivering the groceries just because somebody's in your apartment building. We're going to have to really work together to try to get through this period of time without the waste that we now engender. I mean, we have an enormously expensive care system because it is so medicalized, as we were talking about earlier.